Mr. MC. Ladies and gentlemen, Honorable Chairman for the very important PhD, Honorable Director General of the Service, Deputy Minister of Health, all protocol observed. I'm really impressed to be here this morning to share that a few message with us. The theme, led by countries, powered by people, 20 years of progress, 20 years of partnership. It is indeed good to remind all of us that we've been celebrating WTBD for the past 20 years, and today marks exactly the 20th year. And so congratulations to all of us in the forum. May I also take the opportunity to appreciate the government for a few support is given to tuberculosis. I understand that a couple of some gene expert machines have been donated, as well as some digital X-rays. I think the program manager is addressed keeping communications on that. But like Oliver Twist, we still need more, and so we expect government to do even more. And like the WHO rep just said, and the UN high-level meeting came up with a lot of competing topics, of which Ghana government is part. But as of now, we haven't seen much progress in that. We still urge government to do more for TB. Let me bore you a little bit with the chronology of TB themes across the time. Beginning from a journey of collaboration, 2006, the theme was Action for Life, Stop TB, bringing out urgency for tuberculosis. 2007, TB Anywhere is TB Everywhere, showing global solidarity. In 2008 to 2009, I am stopping TB. That's a personalized responsibility. In 2010, it was Innovate to Accelerate Action, indicating innovation. In 2011, it's Transforming the Fight, meaning change. In 2012, Call for a World Free of TB. That was Advocacy. 2013, Stop TB in My Lifetime. That was Accountability. In 2014, Reach the 3 million, which is Access. Then 2015, Gear Up, End TB. That was Momentum. 2016 to 2017, Unite to End TB. That was Unity. 2018, Wanted Leaders for a TB-free world. That was Leadership. 2020, it's time to end TB. That was Action. 2021, the clock is ticking. That's time-sensitive action. 2022, Invest to End TB, Save Lives. That's funding. In 2023 to 2025, to 2026, yes, we can end TB. That's bringing hope and action. With the new US financial support to Africa for 2026 to 2028, which is about 12.64 billion USD, I want to reinvent the next theme for the World TB Day 2027, WHO. Chief Austin, I hope you carry it with you. I'm saying that it should be, since we have had reprioritization because of funding cuts, if more funds are coming in, probably we might have to do detect TB, revitalize supports, indicating intensification for funding and related supports. As a CSO, we have a call. 1, commit to people-centered TB care and community-led solutions. Invest in decentralized diagnosis. I think the last review meeting we had, joint review meeting we had about 2 weeks ago, TB, HIV, malaria, the first time, it was one thing that came out was community case finding. And for me, and for STOPTB partnership, we have always advocated that it's high time we bring TB to the community rather than moving all the community to the health facility. It is not helping. That is why we are not able to meet our 44,000 estimated case that WHO has clearly defined for us. And so I think that very simplified mechanisms to be taken to communities like TB, HIV/AIDS. They are doing very comfortably in the comfort of their bedrooms, in their sitting rooms. They are testing and getting to know their results. Why? It's not the same for tuberculosis. I think if you're able to bring this thing closer to the community, door to door, house to house, whatever, then we are able to make sure that we get all the cases that needed to be detected by TB. And so it's a call for all of us to make sure that TB becomes a household product. On that note, I thank you.